Hi everyone, Dr. Keith Mirante here with Coastal Chiropractic in Madison, Connecticut, and I want to bring this health tip to you this week because I've been having a lot of questions with people, now that the weather's nicer. They're outside, they're being active, and their people are running and biking and jogging and doing things that they haven't done in a while. They're also in the garden, and so people are asking me about low back issues and sciatica. So I want to shed some light on that for you. And the first thing we need to understand is how the body functions. And the way we function is the brain is what controls all function in your body. So it sends messages down the spinal cord to every single organ, cell, and tissue in your body. And the body in turn sends a message up back to the brain telling your brain how your body's functioning. Once that message gets from the brain down the spinal cord, between each one of the bones comes nerves. And these nerves not only supply sensation to what you feel, but they also control muscles, and most importantly, they control organs. So your organs are fully 100% dependent upon receiving the function coming from the brain. Now, if your spine was to stay like this, where it's supposed to, your body's going to be functioning 100%. But due to life's traumas, acute traumas or chronic repetitive traumas, text messaging and sitting at a computer and sedentary job positions, that causes the spine, one or more segments, to move or shift from its normal position. When that happens, that is called subluxation. Subluxation is when one or more or a section of the spine moves from its normal position, and that crushes, damages, or irritates a nerve. When that happens, life cannot get from brain to body, and therefore you cannot heal. Now the first thing we do is, as a society, is when we have a symptom. In this case, we're talking about low back issues or sciatica. Most people will ignore it until it gets bad enough. When it gets bad enough, then we go to the doctor, and most of the time we are given a drug, a medication, or a pill of some sort. And so let's just say you take that drug or that pill. All the symptom is a warning sign your body's not healing how it's supposed to. So the symptom is the symptom of a problem. There's something wrong, and the drug just covers it up. It's never going to take away the problem or never remove it. So when you take that drug, every day the problem stays there. The problem always gets bigger until it gets big enough to cause permanent and irreversible damage. And that's not where I want to see anyone ever go. And so what we need to do is properly evaluate and find out, okay, where's the problem? What's happening? Did that spine shift from its normal position? What's this causing? And exactly where it is. And once we know that, we'll probably know how to reduce subluxation so your body can start healing again how it's supposed to. And so the difference between sciatica and low back pain, sciatica is a general term for anything that's running down the low back into the leg. But we need to find out if the problem's coming from here, here, or here. And so the best way to do that is by taking an x-ray, by doing some testing, so we actually understand exactly where subluxation is happening in your body. But the thing is, I want to make sure that we all understand is that the symptom of the pain is the least of our worries. That's just a warning sign. The thing that I'm most concerned about is when there's subluxation, that shuts off life to your body. And in this case, we're talking about the low back, and the nerves in the low back very specifically go to our large and our small bowel. They also go to our reproductive organs and the bladder and the prostate. So if there is subluxation anywhere in the lower spine, it's shutting off life to these organs. And that's building disease in your body, and you can't leave it there. And so your body typically won't feel that until it's the end result, until there's something major happening in one of those organs. And so the key here is we want to, first that we never worship the symptom. The symptom is just the warning sign. So we want to take the symptom, find out like really truly what's causing it. Once we can find the cause of the problem, address it, and then once we address it and reduce it, then we maintain that just like brushing your teeth. And so this is Dr. Keith Mirante with Coastal Chiropractic in Madison, Connecticut, and I hope you got something from today's tip. Have a great rest of the day.